Assalamualaikum warahmatullahi wabarakatuh. My name is Azra Hakina Daniswara. My ID study number is 2021002037. I will present my answers. The words expanding waistline. Now, in much of the world, the rich are thin, the poor are fat, and people are worrying about obesity. Thanks to rising agricultural productivity, famine is rare all over the globe. According to UN, the number of people short of food fell from 920 meters in 1980 to 799 meters in 2000, even though the world's population increased by 1.6 billion over the period. However, this causes a problem. Obesity is a disease that causes heart disease and kills more people than AIDS and malaria. This disease also causes diabetes and cancer. Diet by comment. If we don't want to get obesity, we have to change our behavior. Many people eat a lot of food if they are hungry, so they have lots of calories in their bodies. Get them young. Dietary habits are established early in childhood. Once people get fat, it is hard for them to get thin. Once they are used to breakfasting on chips and cook, it's hard to change. The state, which has some responsibility for shaping young people, should try to ensure that small citizens aren't overdosing on sugar at primary school. Britain's government talking about tough restriction and advertising junk food to children. It seems unlikely that it will have much effect. Sweden already bans advertising to children, and its young people are as fat as those in comparable countries. Other moves, such as banning junk food from school, it might work better. The cause of obesity. Thin people subsidize fat people through health care. If everybody is forced to pay for the seriously fat, then everybody has an interest in seeing them slim down. Insurance companies should be able to charge fat people more because they cost more. Message of the text. Obesity causes many diseases, such as heart disease, cancer, and diabetes. Obesity harms thin people. Obesity kills more people than AIDS and malaria. Therefore, do not let us be obese. There are ways to prevent obesity. For example, frequent exercise, consuming nutritious food, going on a diet, getting enough sleep, limiting consumption of foods high in fat and sugar, and limiting consumption of junk food. My opinion, diet program can result in weight loss in the short term. Maintaining this weight loss is often difficult and requires constant practice. For efforts to prevent obesity, WHO recommends increasing consumption of vegetables, fruit, and whole grains, overcoming calorie intake from saturated fat and replacing it with unsaturated fat and limiting sugar intake. The bad impact caused by obesity is that it makes it difficult for sufferers to get clothes that can be worn. Fat people are also often with by people and also often get bullied. If you do not want to experience these things, then we must prevent obesity. Diets are often postponed. Our plans are tomorrow. The next day, we plan tomorrow, and so on. If it is often postponed, then we will be obese. That's all I can say. Assalamualaikum warahmatullahi wabarakatuh.